In a remarkable press conference and announcement at the White House, President Trump and Health and Human Services Secretary Robert F. Kennedy Jr. say that HHS is publishing what they see as a direct link between children who are born with autism and are on the autism spectrum and pregnant mothers who take Tylenol. In particular, the link is between the active ingredient in Tylenol, acetaminophen, which President Trump essentially declared as unsafe and very explicitly said multiple times not to take it if you are a pregnant woman. Take a listen to what we heard from the Roosevelt Room inside the White House.
If you're pregnant, don't take Tylenol. When you have your baby, don't give your baby Tylenol at all, unless it's absolutely necessary. Don't do it. Break up your visits to the doctors. Break them up. Do it in 5 if you can.
As a result of that announcement, Secretary Kennedy said that there are going to be some policy changes, one being that the FDA, the NIH, and the CMS will be involved in doing a series of things, changing the labels on Tylenol to issue warnings to pregnant mothers explicitly about the risks of autism. They will be working to push leucovorin, which is a separate drug, as a potential treatment for children who are on the autism spectrum. HHS is also going to be funding and pushing for research into several other areas that might be causing autism. And in RFK Jr.'s read, that includes looking at vaccines as a potential link between autism there. Despite that the vast majority of the medical community still looks at the link between autism and vaccines as something that does not have evidence behind it, that has largely been debunked, and that there is not sufficient data for. Nonetheless, that is now the policy here at HHS. Secretary Kennedy saying they will continue to move forward doing that kind of research as well. Now, on the drug leucovorin, which again, as we mentioned, is now going to be prescribed as a potential treatment for autism, the Centers for Medicare and Medicaid, the director, Dr. Oz, now says that all state Medicaids are going to be forced to cover that drug so that any child who is on the autism spectrum and whose parents want to have that as a treatment will be able to have access to it.